Hello, I'm Dr. Lucy, and this is the Primal Alternative podcast. I often like to start with, what did I have for breakfast? So it's actually easy for me to answer for that because the majority of the time I actually have nothing. And I know that many of you will have heard breakfast is the most important meal of the day. And I certainly preached that to my patients for decades. But honestly, the most important meal of the day is the first meal of the day at whatever time that happens to be. And it doesn't have to be 6 o'clock in the morning. So for me, I usually start with coffee. And it's just a black coffee. And then my first meal of the day, that can be at any time in which I'm particularly hungry, is always a protein-laden meal. So it might be something like scrambled eggs, boiled eggs. I'm a bit of an eggs person. They're easy. My brain always likes easy. Or it'll be some leftovers. Or occasionally I will have some yogurt with some granola and berries. But again, I always have to make sure that I've hit that protein macro. So sometimes I start with eggs. So I have a 2-course breakfast. But there we go. That's my tip of the day. Start with a high protein breakfast at any particular time you like.
Perfect. So Dr. Lucy, can you share your personal journey from being a medical doctor to embracing a low-carb, real food lifestyle? What were the key turning points that led you to make this transformation?
Oh, absolutely, Helen. So I call myself the dieting queen. I was a long-term dieter. I used to manage my weight by dieting. I'd go on a diet. I'd be really strict. I was very good. I have a lot of willpower. But what would eventually happen is that I would either get to my goal weight and then the wheels would fall off and I'd just go back on whatever my previous eating style was. And over time, the weight would all just come back on. Or alternatively, I would have some sort of stressful event in my life. I wouldn't even get to whatever the magical goal was, and I'd just go on a bender. And so I was either perfect or on a bender. And this seesawing, yo-yoing, whatever you call it, lifestyle, I had really no understanding or no self-awareness of my thought patterns. I just didn't know. All I knew was that to lose weight, I would eat less. I'd go madly at the gym and do all my exercise. And to gain weight, I just thought, well, it's because I was eating too much. I was just, being greedy. Again, I'd be on a bender. It would be high sugar. Sugar was my thing. I was always calling myself a chocoholic, a lolitarian, sweet tooth. I'd go out to breakfast and eat pancakes, or I'd eat French toast with maple syrup. It was always the sweet stuff. And part of this, I used to think to myself, how could I live a life without chocolate? So I'd be in my practice and I'd be perhaps talking to people about stopping smoking. And in the back of my mind, I'm thinking, God, I'm asking them to give up something they love. How could I ever give up chocolate? I would never be able to do it. I'd die. Like, that was the talk. I'd die, which is clearly far from the truth. But seriously, I just thought my life would not be worth living if I couldn't just sit on the couch and scoff a bag of Maltesers while I was reading a book. So this was just my thought process for decades. And then I got to the point where I was in my late 40s. I was, fatter than I'd ever been, heavier than when I was pregnant with my very, very big babies, and wearing elastic-waisted pants. And I just sort of thought to myself, oh, look, this is it. I'm just destined for this because I'm middle-aged. My husband still loves me, so, who cares? It doesn't really matter. And then there were 2 things that triggered me into taking some action. So the first thing was that I kept actually getting heavier. Like, I realized there was actually no upper limit, because I'd do this thing where I'd bargain with myself and I'd go, oh, look, if I stay this amount, that'll be all right. I've got some clothes that fit. Maybe I'm not perfect, but it doesn't matter. And then, 5 more kilos would go on. I go, oh, well, if I stay this amount, it'll be all right. And I just kept bargaining. And then one day I just thought, actually, it's never going to stop. I've just got this gigantic shed and it's storage shed. It's never going to stop. So there was that. And then there was, sadly, the diagnosis of some metabolic dysfunction. So I actually had fatty liver disease, insulin resistance, pre-diabetes. And I just thought, oh, God, what's going on here? I'm a doctor and I've got pre-diabetes and fatty liver disease. And, I didn't drink a lot, but I ate a shit ton of sugar. So I just had to. So anyway, I actually stumbled across low carb when I was on yet another diet we went on holidays and I said to my friend, oh, look, I'm really sorry. I'm going to have to be on a diet on these holidays. I'm just, so I'm sitting there eating carrot sticks and I look at her and I go, you look amazing. What's been going on? She goes, I've just ditched the carbs. And I go, well, what do you mean? So she told me about it. Then she's telling me about how she's eating steak and eggs and no fruit. And I'm thinking, I'm literally sitting there eating a bag of carrot sticks that I'd picked up. And I'm thinking, what? That sounds like rubbish. So I initially ignored it. And then on the holidays, saw what she was eating. I thought, God, that looks good. Really looks good, because I had been the low fat diet queen. And the idea of putting butter on your steak just seemed like amazing and indulgent. And I thought, how could this work? And then I thought I'll give it a crack, and I initially treated it like another diet, like every other diet I'd ever been on. And I learned and I did macros and I counted and whatnot. And the amazing thing that happened for me was that I just had this different level of energy and this different amount of less brain chatter. I had so much brain chatter my whole life with dieting. Will I, won't I? Have it. A little bit won't hurt. Just have a little bit. You can have a little bit. Come on. There was like this little evil twin inside going, come on, just have a little bit. And that she just stopped talking. And it was like, wow. And I think for the first time in my life, I was fueled properly. And so that then gave me this space to then work backwards and unlearn all my diet culture and all the diet stories and behavior and things that I'd been taught. And I just rewrote them. And so now I'm not on a diet. I have had stable weight for the last 5 years. I just am a low carbitarian, and it's not always easy, but it is so much easier than it was.
Amazing. What an inspiring story. And 20 kilos down as well, right?
Yeah. Yep. Yeah, 20 kilos. And look, your listeners obviously can't see me, but I also have muscular dystrophy. So one of the tools I would use to manage my weight, as I said, was madly exercising, going to the gym, like, two sessions a day, because the whole idea was, of course, in my mind, to be as small as possible. And I mean, that was just another layer that I had to, I guess, learn, because I'm tall. And so for my whole life, I was always called a big girl. Oh, you're a big girl. Oh, she's such a big girl. And of course, in our language, big girls is a euphemism for fat girls, overweight girls. And so, yeah, I started dieting at 16 because I was trying to be smaller. So again, so two things, I think. It's finding that understanding that metabolic health drive, and then understanding that mind management, which includes redefining body image, which is super important. You don't need to be thin to be worthy, and you don't need to be thin to be healthy, but certainly improving your metabolic health will result in weight loss.
So as a doctor, what were the common challenges and health problems that you saw in your patients related to weight loss and obesity? And how did these experiences shape your approach to helping others in their weight loss journey?
I have done, whatever the opposite of 180 degrees, like a 720-degree pivot. So I now, I used to preach the same old diet advice and just tell people, you just need to stop it. Just stop eating the sugar. That was my tool. One tool, stop it. And recognizing that for so many of these people, they're just underfueled. They're not getting the right fuel. So I'd been giving them the wrong map. And now, of course, seeing my my own experience, my initial. So then I just thought, right, I've got to tell the whole world. I became like a low carb zealot, like lots of people do. It's so exciting. You feel so good. You just want to tell everybody. And so I opened a clinic, and I initially called it Epiphany because I thought, oh my God, I have had an epiphany. But there are a couple of problems with this name. One was that not everybody knew what an epiphany was. Some people thought it was religious because there is the Holy Epiphany, which is some religious event. And the third, and probably the trigger for me changing the name, was that some people called it Epiphany. Yeah. Yeah. Epiphany weight loss. No. So, So anyway, then I've partnered with Dr. Mary, and we rebranded as Real Life Medicine, which actually fits so much more in keeping with who we are as real people and experiencing, the real ups and downs of life. So that meant that everything changed for me. I recognized that there are people with fatty liver disease who I used to do what I'm sure a lot of doctors still do is, oh, you've just got a touch of fatty liver disease. Not much we can do about that. Oh, look, you're almost, you're not, you've got a little bit, you're close to diabetes. You're not there yet. So, just go and lose a bit of weight, and general just rubbish advice. I used to prescribe statins all the time, and now I'm much more judicious with them. Blood pressure, because in my mind, the thought I had was that diet and exercise don't work. So what's the point of even telling people about them? And I didn't realize that it was the type of diet and the type of exercise that I was used to myself that didn't work. So changing, again, focusing on nutrition and nourishment and helping people with what they can eat and what is more, eat more of these things, because most people just think of a diet as restrictive. You can't eat this, you can't eat that. Whereas if you actually say to people, you know what, you can eat more protein, you can have some more fat in your diet. Yeah, have some veggies, but, you don't have to view everything in your life as being, I can't have this and I can't have that.
Perfect. Amazing. So insulin resistance, you touched on it before. It's a common issue associated with weight gain and metabolic disorders. So can you explain what it is and how one person could identify if they've got it? And also, while you're at it, I've heard you mention this woodshed analogy in the work that you do. Could you elaborate on this analogy and tell us how it relates to understanding insulin resistance?
Yeah, absolutely. So I think the general population, again, there's, even within the low carb world, there's varying degrees of knowledge, and there are some people who are extremely knowledgeable and understand exactly what's going on with metabolic hormones. But if I was to go and interview the general public and I'd say to them, do you know what insulin resistance is? Most people would have no idea. And so it's really important for people to, I guess, have some way of relating what that is to who they are. So the way I like to describe it is, so insulin is a hormone. It's made by our pancreas, and its main job is to regulate our blood glucose. So most people will know that blood glucose is important. If we have too much glucose, then we're developing type 2 diabetes. If we have not enough, then we get those hypoglycemic experiences that lots of people who don't have diabetes still experience. So glucose is a bit like Goldilocks. We need just the right amount to fuel our body. So the pancreas's job is to make as much insulin as necessary to do that, and to keep our blood sugar regulated, and to move glucose into the muscles where it's used for fuel. The problem we have is that the pancreas, such a good pancreas. I'm always saying to it, you're a good pancreas. It's very enthusiastic, and it will make buckets of this insulin, which is helpful to keep your blood sugar under control. But insulin has a few side gigs, and one of them is it locks away your fat stores. So you cannot burn fat while you have high insulin. So all of a sudden, we've got a whole population of people with very high blood insulin levels. They have no idea about this. which means they can't access their fat. They cannot lose fat. They can't burn fat. They just can't use the fat that they're carrying around. So to try and put this into just some easy to understand terms, I say to people, if you imagine, if you're trying to heat your house and you've got an open fireplace, you tend to use some kindling to get it started, and then we'll put some logs on. And if we do that, that's how a fireplace runs effectively, heats the house, and everyone's happy. What we've done is we live in a world where we are putting lots of kindling on all the time. We've got a giant pile of kindling next to our fireplace, and we add it on, and we have to keep adding it on because it only lasts. Imagine if you're trying to actually heat your house with kindling. You'd be sitting there like every 10 minutes putting stuff on. And what's happened for us, the people with insulin resistance, which is a lot, like well and truly over 60 or 70% in some parts of our population. So a huge amount of people have this. They don't have any logs next to their fireplace. Their logs are all in a woodshed out the back. So, they're trying to heat their house. They get their kindling, they put that on, and they think, I must go out and get some logs. And so they toddle out to the woodshed, and they look in the window and they can see them all. Stacks, heaps of logs, all there ready to burn. They go to open the door and they can't open it. And the door is locked with a padlock. And that padlock is insulin. So if you have really high levels, you might have 9 or 10 padlocks on your shed, and there's no way you're going to open it. And so you come back to your fireplace and it's looking a bit sad, and the coals are getting low and the embers are getting low. And so you have to fuel it. And the only fuel you've got is more kindling. And if you leave it too long, and this is where I reckon lots of people relate to, if they leave it too long, they just start to get lightheaded, dizzy, they can't think. And all of a sudden their brain starts telling them, eat something, for God's sake, eat something. And their brain is also very clever and knows it needs simple, quick sugars. So it's then looking for, Mars bars or something that it can digest quickly, quick hit. And it might be drink, it might be Coke, it might be, sugar, coffee with sugar in it. It might be a dare, whatever, anything. There's so much available again. And every time that happens, basically we pop another lock on the woodshed. So therefore, we want to open the woodshed, and the only way to do that is to reduce insulin. And the way we reduce insulin, there's a couple of ways, but one of the most effective ways is to reduce the kindling in the first place. So the kindling is your carbohydrates. So reduce that. We then at the start, in particular, if I take away all the kindling, if I say to somebody, listen, here's just 2 sticks of kindling for the day, they're going to run out of fuel because their shed's not yet open. So we have to have lots of fat at the start. It's really hard for people when they first hear about it. Their palate is so attuned to low fat, and it feels, for some people, it feels really hard. For me, it was like, oh my God,
hallelujah,
come to mama, I'm home. Yeah. Absolutely. But for some people, I recognize it is hard. And so we have to really just encourage them. But then what happens is their woodshed opens, and all of a sudden they go, oh my God, I'm not hungry. And the telltale sign for me is always if they say to me, Lucy, I just can't look at another plate of bacon and eggs for breakfast. What else can I have? And that's when I go, your woodshed's open. That's why you don't need anything else. Just wait. Just have nothing and wait till you're hungry. And all of a sudden your brain will go, okay, I can do bacon and eggs now. And that's part of the reason why we have moved into things like carbohydrates. You can eat them any old time. Any old time. You can be at a barbecue and you've just had a whole pile of, good food, maybe some steak, some salad, and then someone comes around with a plate of leftover lamb chops with the tail on it, and your brain's going, oh, no, thanks. No way, I can't fit another thing in. And then 5 minutes later, they're out with the pavlova, and your brain goes, oh, yes, please. So we can always fit carbohydrate in. But if it's fat and protein and we don't want it, it's because we're actually fueled and full.
So traditional weight loss options often revolve around bariatric surgery and medication. So how do you feel about the lack of alternative options available to patients, and what motivated you to establish your clinic, Epiphany as it started off, but now it's a lot more descriptive, does what it says on the tin, that offers that different approach?
Well, look, certainly. So, we're in a very interesting stage in the world with relation to body image, body size, and health. And it's really navigating it's quite a, to use a very, a colloquialism, it is a minefield. And the minefield is this idea that shaming people into losing weight is really, really unhelpful. Doesn't work. I know we've done it for a long, long time. Our society has done it. And certainly, I often talk about diet culture. My mum is a long-term dieter, and they had every week the person that put on the most weight for the week. So everyone, of course, got weighed. Everyone's weights were all called out. And the person that put on the most weight, they got given a pig badge. And they had to wear that badge for the rest of the week. Yeah. And of course, the thinking behind it is that you will do anything to avoid the shame of wearing the pig badge. So therefore you will do your diet or whatever it was. But honestly, that's not how humans work. We don't work like that. And whilst it seems like a good idea at the time, it was a terrible idea and just made people feel really, really bad about themselves. So the concept is that we, as a doctor, there are people who have a BMI that is over 25 and they're still very healthy. So again, the traditional thing of BMI between 20 and 25 is defined as the healthy weight range. That's not strictly true. You can be over that and still be healthy. And that's perfectly fine. We don't all need to, look like Margot Robbie. I'm just thinking of the Barbie movie to be healthy. Okay. You can be very healthy in a body that is a BMI over the 25. But there comes a point where insulin resistance, where we start to see things like fatty liver disease, like type 2 diabetes, like hypertension, like heart disease, that do increase, obviously, our health, affect our health and increase our risk of death, which is unhelpful, and, and just reduce our quality of life. And the majority of all of those conditions are related to insulin. So if we get the insulin down, take the padlocks off the shed will open, the person can burn their own fat. Now, the tricky thing is that it's I'd love to say it's super easy. It's not. If it was super easy, everyone would do it. So there are lots of factors that come to why people gain weight in the first place. Some of it is that, that a bit like me, they would just dieted. That was the only tool they knew about dieting, not dieting. For a lot of other people, there are things like trauma that in childhood that cause this trauma response, and they're using food as their soothing, their safety, their being in a bigger body is safe. All of those things, their psychological overlay, are really, really important. And for some people, just saying to them, "We'll change what you eat," it's hard for them. But the thing I think is that bariatric surgery, a lot of people think that's going to help them straight away. Like that's all they need. All they need to do is get thin and they'll be fine again. What we really need to look at is what is the root cause? What caused the weight gain in the first place? Not just what did you eat, but why did you eat? And the why did you eat is never done judgmentally. It's never done with, well, from my point of view, is never done with asking, making people feel ashamed, because all it is a tool that they often use to self-soothe, to feel better. And our brain is always just trying to keep us safe and make us feel better. And for some people, food serves those two purposes and it's available. And so often I always say to people, listen, we need to move past feeling bad about ourselves. Feel bad. If you murder somebody, I want you to feel bad. If you rip off an old lady on some internet scam, I want you to feel bad. If you've binged on chocolate because you've had a terrible day, I don't want you to feel bad about that. What we want to be able to do is go, okay, well, what can we do to change this behavior in a really non-judgmental way? So certainly lots of my patients have had bariatric surgery and not been able to maintain their weight loss because bariatric surgery doesn't always address the root cause. I think it can be a helpful tool, but it's not always the only tool.
Amazing. So transitioning from working in surgery to the online space can be a significant change. So can you share your experience of launching and reaching more people online? Because I do have a lot of people that follow along who are wellness entrepreneurs as well, who would love to learn, the strategies or techniques that you found most effective in promoting yourself and your message to a wider audience.
Yeah, absolutely. Well, you're totally right, Helen. I mean, as a doctor, I didn't advertise at all. I just got a room and suddenly the people just poured on in. And in fact, to the point where I had to close books, I had more people than I could see, which is really part of the reason for moving into the online space, is that you can see and help a lot of people without having to do the one-to-one. So the one-to-one problem is that you're repeating the same message. You're saying it 20 times a day. And it's like, right, imagine if I had you all in one room and I could just say the same thing to all of you and we could have a discussion around it. And, that would be, and one person could ask a question and the other person could go, yeah, I was thinking that. And so it really consolidates what you're trying to say and reaching people in a way, I personally think in a way that is much more effective than the one-to-one. The one-to-one can certainly be useful, particularly for people that have very specific medical needs, and particularly things like eating disorders. Or they probably need one-to-one. But for lots of people, the group coaching works really well for us. So we designed a program which is called the 12-week Mind-Body Rebalance because for two reasons. It's that metabolic map to heal that metabolic processes, the insulin resistance that I was just talking about, that, I'm sure your listeners are all aware of as well. But doing that in a way that is, backed in science, with somebody, hopefully, who knows, hopefully we know what we're talking about. It's interesting. As a doctor, I think there are certainly plenty of doctors who are pretty rigid in their thinking. And both Mary and I are always refining. So refining the message is to look at what's new, particularly with the low-carb world. And, these days, when we first started, we didn't focus enough on protein. And now it's becoming apparent that protein is really critical for many things. So, we're just always refining our message. But the thing about particularly the 12-week mind-body rebalance is that it's really the mind. It is the mind. Once you learn what you need to do, lots of people will take that map and just go, good, thank you, see you later. And I go, goodbye, see you, I'm so happy, well done. And then there are other people who can't, it's like they can't read the map, and that's their mind. So they need, an internal compass to help them. And that is really just unpacking a whole heap of that, and we call it diet trauma, the shame, the guilt, the patterns, the ideas, the restrictions, the thoughts and the feelings that then create your actions. So yeah, we spend a lot of time on that, which is really what we love, because that's where the change actually happens. Everyone can do something for a short period of time, but if you want to do it long term, then you really do need to change your thoughts and feelings.
Absolutely. So managing your time and maintaining your busy schedule can be really challenging. So how do you balance your work in the weight loss clinic, online, and in your personal life? And are there any specific rituals or practices you follow to ensure that you can provide amazing service whilst also taking care of yourself?
Absolutely. So I also realized I didn't particularly answer your last question well, because two things happened. So we started this the online space right when COVID hit. It was in May 2020, just after all the restrictions. And initially people said, oh, you'll need to wait because, there's COVID, there's all this uncertainty. People haven't got any money to be spending on weight loss. And it was like, well, we're ready. So we just went for it. So the thing that people will always be telling you, you're not ready, you're not good enough, don't, nobody's going to do this. Like we're, the naysayers. And look, honestly, I just didn't listen to them. So both Mary and I did work very hard in that first year, getting our programs up and running. And really, it was like running two jobs. And for us, COVID was a bit of a blessing because we were in Melbourne and we were locked down for a very long time. So there was sort of nothing else to do. So then the transition was that I was working 4 days, and I worked 3 days, and I worked 2 days. So I slowly stopped working on one-to-one and increased the one-to-many as the business grew, which is, I think, and it's hard. It's a bit, there's always going to be a critical time where you either think you're working too hard in your two businesses, or you're not working enough because, there's not enough money coming in or something like that. And I often think it's a bit like when you've had babies and your babies are transitioning their sleep. And so, they've gone from 2 sleeps a day to 1 sleep, and that's not quite enough. Then they go to no sleeps. And so you just have to ride that rough bit. And that's you just have to ride it through. But learning, so that it's weight loss is very much like business. It's about the strategy and the mindset. So we learnt the strategy and then managed our mindset around it. So that is really critical. You can't run an online business just by making the course. The course is actually the least important bit, because what happens is you make the course and no one knows about it. You've actually got to market the course, which I think for a lot of people is the hard bit. And that does involve most days engaging with an audience somewhere, because if you want to run an online business, well, then the people are online. So you need to reach them online, which does mean doing things that some people find a bit awkward, like, Facebook Lives or Instagram Lives or making reels and all of that stuff that, I had to learn. But I love it. I love learning new things. So for me, I just looked at it as like, it's like learning a new language. It's sort of fun and it's challenging. And so, so that was good. So then to bring this all the full circle about how do I care for myself, again, I have a potential to be a bit of a workaholic. My husband calls my office the bunker, and every now and then he'll say, you need to come out of your bunker. And so I did. So now I don't work in the clinic at all. So I don't actually have to go to work ever, as in a building, but I do all my work online, all my work in my bunker. And so in order to be really intentional about that, I have a few things that I do. And one of them is cold water swimming. So I started swimming. So we have a pool. I mean, I've had a pool in my backyard for many, many years, and I hardly used it. I'm sort of cross with myself now, but I'm being kind about that. And now I'm in it most days, even so it's currently, the middle of winter in Melbourne. The pool's not heated. It's very, very cold. But I use that as it's like invigorating. And so I get in there and I'm doing this, but I know it's super good for my mitochondrial health. So, and again, we haven't even talked about that, but that's another whole layer. And for me, mitochondrial health is the next level. So, low carb first, all of those holistic health things that we talk about. Mitochondrial is the next level. What levers can I pull to improve my mitochondrial health? So, so I do that. And we've also, I've outsourced. So I now have got to the point in our business where we can outsource the things that don't need a doctor to do. So I don't need a doctor to make a few Canva tiles. I don't need, a doctor to schedule routine Facebook posts. So we've outsourced not everything, but most things that don't need a doctor to do. But the thing I would say as a business owner is that you do need to know how to do it. You don't have to do it, but you need to know how to do it. And I know how to do every single thing in our business. I can make the web page. I can make a landing page. I can do the offer. I can do it all. I don't have to, but I know I need to know how to.
Amazing. So amazing. And you taught me a word not so long ago, and I said it wrong. Ikigai.
Ikigai, yes.
Ikigai.
Yes.
Because I've sent you some lovely Primal Alternative goodies for your presence on the podcast today. And I know we've been had a couple of Primal Alternative stalls at your low carb roadshow, which has been incredible what you've been doing there. So I'd love you to share a little bit about what you meant when you said that, because it was such a beautiful word and it's really resonated.
Yeah. So ikigai is a Japanese word, and it's spelled Ikigai. And I always need a little prompt to remember how to pronounce words that are a bit foreign to me. So it rhymes with sticky eye, which is sort of useful as a doctor. So your ikigai, and it's your purpose in life. And basically, if you imagine like a Venn diagram, so you've got 4 circles, and the circles are, something that you like doing, something that you're good at, something the world needs, and something that will make you a living. So if you can find something that fits all of those circles in the middle, that's your ikigai. So I use that in relation to your business, Helen, because for lots of women, and I know men do, anyone who's a primalista, that can be your ikigai. You can be, if you love baking, you love low carb. The world certainly needs whole foods that are home baked, that maybe not necessarily baked by me, since I'm not a good baker, but someone else can, and it can make you a living, then that's ikigai. So, I think in the world we really need options that are like homemade food that not everyone's making, because the processed food industry is a massive juggernaut, and the only way to counter it is to provide an alternative to people, or for people. So I think that's the name of your business, isn't it? It's an alternative.
Yeah, exactly. Beautiful. And you found your ikigai, and I found mine, and it's a joy every day. So much fun, and it's very fulfilling. So thank you so much for I think that was definitely the best description of insulin resistance I've ever heard in all my years of trying to wrap my head around insulin resistance. So thank you for that.
Yeah.
So before you go,
you're welcome. Well, as I said, I always just say to people, all you need to do is, look at everything is, will this open my shed or close my shed? It's not about good and bad. It's what's going to help me keep my shed open.
Yeah, I love it. The locks on the shed is so good, so easy, and I'm very visual, so I can see that shed with all those padlocks on it. So it's very good. So before you go, Dr. Lucy, tell us where's the best place to find you, and if we wanted to get on with your amazing sounding course, where would we find out about that?
Okay. So our business is called Real Life Medicine, and as I talked about, that is truly who we are. We're real, and we're not perfect, but we live real life. Dr. Mary has little kids. She runs a very busy life, so we really spend a lot of time telling people or teaching people how you can doesn't have to be perfect, and life doesn't have to be perfect for you to change what you're doing. So all of our social media and everything is under Real Life Medicine. Unfortunately, the Real Life Medicine domain name is already bought and, needed $5 million to unlock or whatever. So we've shortened it to RL Medicine. So RL for Real Life. So it's rlmedicine.com. And our signature program, which is the mind-body rebalance, so really tapping particularly into that mindset, we only run that 3 times a year because it's pretty intense, and we're in there just basically walking people through it, like literally, not literally, but figuratively holding their hand. So it is intense, but it's transformational. And the next one of that starts first week of September, so shortly. And you can just go to rlmedicine.com/12 capital WMBR. So it's 12-week mind-body rebalance.
Perfect.
WMBR.
And we'll have those links in the show notes as well. Dr. Lucy, thank you so much for your time today. It's been real, it's been life, and it's also been funny.
Thanks so much for having me, Helen. I really appreciate it. And I'm so happy that your brand offers, as I said, a beautiful alternative for all, because that's what we speak to our people about is what can you eat? What is helpful to eat? And the more brands that we have that are really aligned with just that low carb, real food message, the better.
Awesome. Thank you.